certain personality traits that are self-negating that kind of put our needs
Mm.
below another person's really sets us up for neuroplastic symptoms later, which can be long COVID or chronic fatigue or chronic pain.
I've talked with over 250 people who've recovered from conditions like ME/CFS or long COVID, but only a handful have been medical doctors who went through it themselves. And my guest today has been on both sides of the exam table and as a result has really powerful insights to share. If you're new here, I'm Raylan Agle, and I talk to people who've walked the hard road and come out on the other side to share what works and what doesn't work with you because recovery from complex conditions shouldn't be a guessing game. I'm so excited to introduce today's guest, Dr. Rachel Hollander, joining us from Little Rock, Arkansas. She is a board certified family medicine physician who spent over a decade in practice until chronic pain, heart palpitations, and many other symptoms sidelined her for 8 years. Eventually, she couldn't work, was facing surgery, and kept hearing, we have no real answers. And then she discovered the work of a fellow physician and recovery pioneer and saw, get this, an 80% improvement in her symptoms and pain overnight. Overnight. With these new tools and insights that she learned, she didn't just now manage, she fully recovered. So, if you felt stuck or dismissed or like no one has real answers, this conversation is going to be a game changer. Dr. Hollander is helping close the gap between what medicine often overlooks and what truly leads to recovery. So let's dive in. Dr. Hollander, so incredible to have you here. Thanks for doing this.
Thank you.
Oh my goodness. When I read about your journey to where you are now, it is absolutely incredible. So, tell us about that. What, because I know you do this professionally, but you also have a long personal journey with this. So, yeah, what did that look like?
Yeah, I'm trained as a family physician. I got my own neuroplastic symptoms though, and I'm sure some of your viewers might understand what that means, neuroplastic symptoms, and others might not. It encompasses long COVID, chronic fatigue syndrome. My symptoms were a little bit different, but what neuroplastic symptoms really means is that the brain is intimately connected with the body in creating symptoms by no fault of our own, and the symptoms are completely real and physiologic, psychophysiologic. So the brain and body are intimately connected. And my symptoms started when I was in my first real position as a family doctor. Within months of this position, working about 60 hours a week in
Mm.
2014, I got repetitive motion arm pain and weakness. And I had to go down on my work hours over the next 8 years or so. I had to go down eventually to half time. I used auto click software and dictation software. I should mention that half time was about still 35 hours a week.
Mm.
So that helped a bit, to go down on how much I was working. I also lifted weights to try to strengthen my upper body. But it was so frustrating to see almost a 2 dozen medical practitioners who, in addition to myself, couldn't explain to me something more, what was going on beyond something just structural that, oh, it could be carpal tunnel syndrome or thoracic outlet syndrome. And I had seen so many patient cases that were similar, where someone had what I now understand to be neuroplastic symptoms, but at the time I didn't understand it in that way. But I knew there was something more to it. I had so many patients with chronic pain or POTS or chronic fatigue, and I just knew there was more to it, but didn't fully understand how to put it all together. So it was so frustrating to be a patient myself in that situation. And over the 8 years, as I said, I went down on my work hours, but eventually I had to stop working altogether. I had to leave work suddenly. I didn't have a chance to say goodbye to any of my patients or hardly any of my colleagues. And that was really distressing to have left work and then wonder, well, what am I going to do next? What can I do
Mm.
for work at all in the future? And I had difficulty preparing meals and cleaning and driving a car because my arms were, I was so debilitated. So with all that distress of not knowing what was going to happen next and just not getting better, I developed heart palpitations and difficulty swallowing, and I fainted one day. I had all kinds of heart testing at the ER, and I had an abnormal heart rhythm, but nothing structurally serious. And I had an upper endoscopy to look inside my esophagus with a camera to see was there narrowing or some growth that was causing the symptoms, and there was nothing. And the next day, just knowing that it was nothing, the doctor told me, I was able to eat again, which makes so much sense now, but didn't make any sense to me at the time. How our belief, or fear at the time that something was really scary and wrong, maybe cancer or something, is just poof the next day that it was normal and I could eat again. So I had all these symptoms. Another 8 months went by of me not working, not really doing much besides just trying to figure out my pain. My parents live in Little Rock, Arkansas. I was in California, and my mom had had a fall and broke her pelvis. And so I flew out suddenly to be with her in the hospital and at the rehab facility for the next month or so. And there I was, still with symptoms, still weak and debilitated, and then trying to help my mom, advocate for her at the hospital and the rehab facility. I remember one time I even took her to a doctor appointment after she was discharged from the rehab facility, and I wore a sling on one of my arms because I felt it was the only way to communicate to somebody, please help me push my mom in a wheelchair because I can't do it. And I didn't have a broken arm or anything, but it was like the only way to kind of communicate that because neuroplastic symptoms just aren't understood. So incidentally, a couple months later, I met someone who knew about Dr. John Sarno. He's kind of the pioneer, and he's passed away, but he was kind of the pioneer of neuroplasticity, although they used different terms at the time. She told me about him, and I looked him up on the internet. It led me to Dr. Howard Schubiner's website, unlearnyourpain.com, and I watched an hour's worth of free videos on his website that night, and I just knew everything just clicked. I by this time, after 10 or so years of seeing patients, I had thousands of patient cases that were neuroplastic. So it just clicked when I got that holistic understanding of what's behind all this. And I just knew that I was out of the woods. And the next day, my symptoms were 80% gone. I was able to do anything I could do before. I was able to lift heavy things, to cook, to clean, to lift weights, to do anything, ride a bike. So it was just really, it was that aha moment. And I bought Dr. Schubiner's $30 workbook, Unlearn Your Pain, and I used it to help with further retraining, brain retraining, for the arms, for my difficulty swallowing, which I still had a little bit, and the heart palpitations. So since then, I understand long COVID, I understand chronic fatigue, and I think it does a disservice really to think about these as all separate entities. We got to start
Yeah.
thinking about them all as one because, my patients with long COVID and chronic fatigue, they have chronic pain also. They have pudendal neuralgia and fibromyalgia. Um, they have all these overlapping things, and it's because we all have unique stories as to what's behind our symptoms and exactly what we have. But what's the same is how our brain and body work together or don't work together well.
It is so fascinating and perplexing and frustrating and just so many things to think about. Okay, one, everything that you had to go through and how incredibly difficult that had to be. What that must have felt like being a medical professional yourself and thinking, I don't have the answers. My colleagues don't have the answers. Like, how am I ever going to get past this? And we know we have estimated hundreds of millions of people around the world that are facing this. And then a free video and a $30 workbook and you were
Yeah.
better. So I one of the biggest things that I'm trying to figure out, many of us are trying to figure out how to do is, how do we bridge that information gap? And a lot of people are recovering through, YouTube channels or coaches or people with informational programs, but not medical professionals, people that are just out there teaching about neuroplasticity. So yeah, I guess this is a long way of saying, like, from your perspective, like, how do we get more of the conventional medical system on board
Mhm.
with this? And how do you see that changing? Is it changing?
Yeah. Yeah, good question. Definitely what you're doing is amazing and so important in getting people better. I understand, you've interviewed hundreds of people who've gotten better through many of them neuroplastic approaches. So that is convincing. I will say in Western medicine, it's a whole paradigm of, this biomedical idea where everything is structurally related. As you see, we don't have psychiatry connected to other specialties. If you go to a psychiatrist, they want you to go back to someone else to deal with your pain or deal with your
Yeah.
heart dysfunction. So things just don't connect, and we don't even have good resources for coverage for mental health at the same time. So for one, we're not connecting at all, and then we don't even cover it, and such a stigma develops
Yeah.
from all that. And this was a big part of my pain. I was seeing that it wasn't just that I was overworked. I was seeing that the way I was trained to practice was not helping people. And in many cases, I
Mm.
saw that what I was doing, whether it was prescribing a medication that didn't work or had complications develop afterwards, or sending a patient to a specialist for an injection or a surgery or some other procedure, these patients would come back to me no better or in worse situation, maybe even more
Yeah.
completely disabled. So this was a big part of my pain that I was doing. I was trained and I was practicing in this way that was so much not helping, if
Oh,
anything, making people worse. And we take this Hippocratic oath at the beginning of medical school, you do no harm. And I was seeing that I was doing harm. But
oh my
I can
goodness.
tell you more about, some of the studies later on in the interview that are convincing the
Yeah.
Western medical system about how this all works. And because that paradigm, you have to have these large studies with standardized treatments with very specific results to convince the medical system that this is the way to educate students, medical students, and medical practitioners how to practice.
Yeah, and right now there seems to be a divide happening, and something many of us are trying to bridge that gap because patients are getting frustrated, understandably, with the conventional medical system and not getting the answers that they need. So, and I know I went through this where I just sort of washed my hands of doctors. Like, I'm never
Mhm.
seeing one again. They have nothing to offer, which I know is completely not true and not fair.
I've been there where I
Yeah.
started to, I didn't like doctors. I didn't want to see doctors. Yeah.
Yeah. And then
I didn't do
for a
everything they
year,
suggested.
yes, and then for years, I started realizing that some very simple things that I was facing that I refused to go to doctors for, when I finally did, they could fix. Like, they understood it very well. So,
Yeah.
it's finding ways to work together. And even in my own, like, informational programs that I run for people, I say this is to do in conjunction with your doctor. This is not medical advice. You need your doctor. There's going to be medical needs that you have. And it's just a bit of a scary and heartbreaking thing to see what's happening, that, people are getting frustrated and walking away from their doctors when there's still so much to offer there. And, just how do we bridge that gap? And
Yeah. It
yeah,
takes a doctor who really understands the neuroplastic paradigm of symptoms
yeah,
and the biomedical paradigm. Biomedical paradigm meaning that, something is structural, has tissue damage, it's fully specifically in the body what's going on. And I'll tell you a lot of these things they still overlap a lot of the time. But then the neuroplastic paradigm, understanding how our life experiences influence our stress hormones in an unconscious way that influences our and actually our emotions and stress hormones are completely intertwined in a way that we may not even have a chance to consciously think what's going on with our emotions. And so our life experiences that are difficult or traumatic lead to stress hormones that act on any and potentially every part of the body in a dysfunctional way, potentially. It also affects our immune system. So you think about, well, how are all these people getting cancer anymore at such young ages?
Yes.
Well, there is a reason. And so it takes a doctor who understands both sides, because it's not A and B. It all really goes together. So, just to say a little bit more about the brain, we have so many different parts of the brain that work together when we're experiencing pain or neuroplastic symptoms. Um, so we have several parts of the unconscious brain that work together. And then just 5 to 10% of the brain is really conscious that we're in control of. So, as I said, we have our emotions go along with our danger signals. So, the primary purpose of our brain at all costs is to keep us safe and healthy and alive and survive. So we need to make our brain needs to make sure that we are fed and we have enough water, that we're not too hot or too cold. And our emotions are part of our safety signaling. Our emotions could say something is unsafe. I'm about to get hit by a bus, or there's a tiger chasing me. But our emotions also come into play for very social reasons. We have this human constructed social hierarchy of how to get along in society, and our emotions come into play. So we can have very formative experiences as a child, but also difficult life experiences or traumatic life experiences later on that either prime us or to create neuroplastic symptoms in life, or specifically bring on those symptoms at that time. And, as a kid, I mean, there's been a major study to show, these adverse childhood experiences, including something that's so common, which is having your parents divorce, that shows that these adverse childhood experiences make you so much more vulnerable to getting chronic pain and chronic disease, neuroplastic symptoms later in life. So, in addition to being a child of parents who got divorced, having mental illness in your household or domestic violence, substance abuse in your household, if there was someone in your household who was incarcerated, a variety of difficult experiences, and not all the things that can happen to us in life were even part of that study. So, what about having someone in your family who had a major illness, or having someone you love pass away, moving once or more as a kid or later in life? And then later in life, things that we think are should be exciting and good can still be stressful, like having a new baby or getting married or a new job. So it just there's no end to all the things that can cause stress hormones to impact our body. And since we're a kid too, we develop personality traits. So certain personality traits that are self-negating, that kind of put our needs
Mm.
below another person's, really sets us up for neuroplastic symptoms later, which can be long COVID or chronic fatigue or chronic pain. So if we are a people pleaser, we're caring for others in a way that's beyond caring for ourselves, a do-gooder, feeling guilt or shame easily, being dependent on others where we don't feel autonomous, or being especially shy. All these are personality traits that might make someone more vulnerable to symptoms.
It's great to hear that there is some research and studies that are starting to demonstrate this because over recent years, talking about this here on the channel in different spaces, understandably, a lot of people are skeptical and they're saying, if this is a real thing, like show me the studies, like show me something that backs it. And I know we still have a lot more work to do in that area, but it sounds like we're getting there. We definitely are getting there.
Yeah. Yeah. Specifically for long COVID, a study within the last 5 years was on what's called psychophysiologic symptom relief therapy. And this is essentially something that I provide when I do video visits with patients in my practice called Hollander Holistic Health. So, what it involves is first, helping patients understand how the brain and body work together, as I've kind of talked about. You really have to help patients build their understanding and belief in that and work on their doubts because, like you're saying, they've seen all these other practitioners. They've been told either we don't know what's going on or you have something structural in your back or in your blood test or something like that. And so reframing this for patients and building their belief in this neuroplastic paradigm, which has so much evidence behind it, is so important to start with. So that's part of this psychophysiologic treatment. And also, brain retraining exercises, helping patients in settings of safety gradually re expose themselves to the triggers that have prompted their symptoms. There are a variety of journaling exercises and meditations that can help you distance yourself from how the brain has gotten intimately connected with symptoms for particular body parts. And then, life changes after are so important. But in this long COVID study, they administered over the course of 3 months or so this psychophysiologic symptom relief therapy to it was not a huge study. It was at least 20 patients. So certainly in medicine, we always like to have more. The more patients studied, the better. But it's hard with something that's not just a drug that you administer once and then do a blood test or something or say, "How are you now?" But so this psychophysiologic treatment was given over 3 months, over several sessions to these patients, and the patients had um, they had either high or very high symptom burden of long COVID. They also yeah, so they did this psychophysiologic treatment. What was amazing, they found that 50 to 80%, they had a 50 to 80% reduction in multiple symptoms: shortness of breath, brain fog, chronic pain. So you see how there's overlap. A lot of
Yeah.
long COVID patients have pain that is chronic. And that's huge. I mean, I can't think of any study in some other realm of medicine where like a procedure is given or a drug is given where 50 to 80% reduction in symptoms. It's humongous.
Yeah.
So that's just one study specifically about long COVID, and for other aspects of neuroplasticity, other different types of patients, and you can generalize this. I mean, I feel comfortable generalizing this because, as I said, the brain impacts the body. It all works the same way. But a study on chronic back pain for over 150 patients was published in the Journal of American Medical Association Psychiatry, big journal. So these patients had chronic back pain, ruled out something serious and structural in advance of the study. A third of the patients were given pain reprocessing therapy, similar to kind of what I've talked about, retraining the brain, understanding the neuroscience. They were given that over the course of several weeks. They had an average of 4 out of 10 pain. So on a scale of 1 to 10, how bad is your pain most days of the week? On average, these patients had a 4 of 10. And they were given this pain reprocessing therapy. Over 60%, actually 66% of those patients were not just improved, but either completely pain free after the treatment or what we say nearly pain free, a 1 of 10 pain on the pain scale. So 66%. And that was a third of the patients who got that treatment. Another third in the study got an open label placebo injection. Open label meaning they knew what they were getting, had no medicinal property. They knew it was just saltwater solution, saline solution injected into their back. So, really, if there's any benefit, it can only be placebo. And 20% of those patients got better, which tells you the power of placebo in the mind and belief.
Yeah.
And then the other third of that study, the other third of patients, It was also essentially kind of placebo, but it was like what we do already. Okay, so you just go to your practitioner and they'll do whatever they normally do, usual care. They might give you a prescription for pain or muscle relaxant or send you to physical therapy, usual care. And 10% of those patients were pain free essentially at the end. So 66% with the pain reprocessing therapy, 20% essentially with a placebo injection, and then 10% with what we do anyway.
Oh my
So,
goodness. Wow.
yeah, and in my practice, so again, it's Hollander Holistic Health .com, and I do video visits for patients who they can live anywhere in the world, patients of all ages. I You can set up an appointment on my website. I practice pain reprocessing therapy, as I talked about. There's also emotional awareness and expression therapy. And there's been studies on this too, actually, specifically for patients with fibromyalgia, mostly women who weren't senior age. And another study also within the last several years on older aged men, veterans with chronic pain. And these studies showed that you know, major decrease, significant decrease in not just chronic pain, but also anxiety and depression for both of these groups, and also PTSD for the veterans. So I practice with my patients. I help guide patients. I feel like I'm more of a guide than, I'm not someone who's given a drug or saying, do this, come back later.
Mhm.
We're really working together because it's self-healing. So, pain reprocessing techniques, brain retraining, and also emotional awareness to try to, get at what are those unconscious emotions that got linked with your symptoms way back when you first started to develop symptoms. And again, there's a variety of journaling exercises, but also talk therapy with me, meditations. I use Dr. Howard Schuberner's Unlearn Your Pain workbook quite a bit. I encourage patients to either use that and we go through that longitudinally with our visits over time, or I encourage them to use that FreeMe app. I know you've interviewed
Mm.
the leader behind that specifically for long COVID and chronic fatigue syndrome. Curable is also great, and there's a variety of other resources out there that I list on my website. So, really trying to unlink how our brain and nervous system have associated stressful experiences with symptoms.
That is incredible. And I'll link to you for people watching if you want to try out for free, because I do have the things that I promote and that I support. I get affiliate links so people can get deals. So people can try Curable for 6 weeks for free, and also Free Me you can try for free as well if you want to check out those links in the description. It's incredible. All the resources that are out there, and so amazing that now you can go to your medical doctor like yourself,
Yeah, and
and that
sometimes that's needed just to really be assured, yeah,
yeah,
I had this on my imaging or this on my blood test, but you really think
yes.
it's neuroplastic. Sometimes
Yeah,
it's just really important to have a doctor who understands all of that.
absolutely, which is why I'm always saying continue to work with your doctor, because people will come to me with questions like, "Well, what about this physical thing though?" I'm like, "I can't answer that for you." That's
Sure.
yeah, absolutely incredible. So, and amazing that we are now in this virtual world, because before, the chance of someone landing themselves in your office would be very difficult, right? For most people
Yes.
around the world, it'd be like, well, great that you're out there. But it sounds like you see people, is it from all over the country or is it
Yeah,
globally?
so I'm medically licensed in California, Arkansas, and Missouri. So I can give a little bit more personalized medical advice and
Uh,
practice as a doctor in that way. But as a health coach, which I practice for people anywhere of any age,
Yeah.
I can still give my doctor insight, still practice the same techniques and therapies.
Right. Amazing. And that will, of course, all be linked in the video description. So definitely people check this out. This is so incredible. After growing up with a mother who had chronic fatigue syndrome and just decades of seeing there being just no help and no resources, that it feels nothing short of miraculous to me that, I'm here talking to you, you're out there treating patients, people are getting better, we have answers. It's not just hope, it's concrete evidence that we can do something about this, and people can get their lives back.
Yeah,
That's
it's very exciting. Yeah.
that's amazing.
Yeah, and I'll tell your listeners if they don't already know about the Association for the Treatment of Neuroplastic Symptoms, or ATNS. It's a nonprofit medical, well, I don't even know if it's really a medical organization, but a nonprofit organization made up of patients, practitioners. Practitioners can be health coaches, social workers, therapists. We have some surgeons, a neurosurgeon I've met in that organization, physicians, physical therapists, and audiologists I've met. So there's a lot of resources through this organization if you're still having symptoms. We have yearly conferences, there's monthly webinars, um, a lot of resources on their website as well as my own.
Amazing. Are you gonna be at that conference this year in
I am.
September?
I went last year. Last year was the first one in person after the pandemic, and then I viewed the one before virtually. But yeah, I am going to be at the one this year in late September in Boulder, Colorado.
Um,
It's so much fun. I mean, because 90% of the people there have had their own symptoms, even though they're practitioners, and that's kind of what led them to become a practitioner.
oh,
So you just feel like you're in your network of people who you get and get you.
yeah. Well, I will be there as well, so we'll
Oh,
get
I'm
to
so
hang out in
excited.
person.
Good.
Yes.
I
I
look
think
forward
I
to meeting you.
think my head's gonna explode being surrounded by so many people who get it and are all speaking the
Yes.
same language. Just
Yes.
absolutely incredible. All right. Well, any final, for people listening, watching that have been in the thick of this for a really long time, what would you say to them?
It takes openness to something different. It takes some motivation. I know that's really hard when you are in the thick of
Yeah.
symptoms. Um, it may take some time to get better, but if you dive into this paradigm, I have no doubt that anyone can get better. And I want to thank you so much, Raylan, for what you do, because I can only imagine how stressful it is to have a podcast with so many subscribers and, for patients and people who have such difficult symptoms. What you're doing is just such at the forefront of everything right now. This is part of a revolution in not just medicine, but it's at the intersection with social media and everything. And I just think what you're doing is so important. So thank you so much.
Well, I appreciate you saying that. I absolutely love doing it. I learned so much from it. And so it's so incredible after having grown up with a mother who never got better and just all the suffering I've seen to just be putting all this out there in the world feels like such a gift to myself to be able to be a part of it. So, and thank you so much for taking the time to be here. I know it's extra validating for people when they hear from medical professionals saying, this is real. We know what's happening. We know how to treat it. Like,
Yes. And I've
finally.
been there.
Yeah.
Been
Yes.
with my
Yeah.
own types of
Yeah.
symptoms. Yeah. Thank
Amazing.
you.
Amazing. Well, I will link. I'm fortunate that we've had quite a few medical doctors here on the channel. So if you're watching, listening, and this is resonating and you're like, yes, I want to hear more, from the medical community, I'll link a playlist that is just all medical doctors who are, up to speed in the know and helping people every day. And again, everything for Dr. Hollander is linked in the video description. Definitely do yourself a favor, take a moment, check all of that out. There's no need to suffer to go through this alone. There is help available. We have answers. There is support. So, yeah, thank you so much for being here. Dr. Hollander, this has been absolutely incredible.
Thank you.
And thank you to those of you watching and listening. And I hope to see you in one of these next videos from our medical doctor playlist. Bye, everyone.